This is Yvonne Chaka Chaka talking to you about malaria. Malaria can kill you, so it is important to protect yourself. Malaria can be prevented, treated and cured if it is diagnosed early enough. This book will tell you how to be safe. Malaria makes us very sick with fever, body pain, vomiting, headaches, and high temperature. Malaria makes us very tired. Often malaria makes us lose our appetite and get diarrhea. It can take from 9 to 30 days to get sick after being bitten. As malaria becomes worse, a malaria patient could start behaving very strangely. They may not be able to sit, walk, or speak properly. Sometimes they won't know who their friends and family are. People with malaria can have fits and faint. A person gets malaria by being bitten by an infected female mosquito. Not all mosquitoes give you malaria. Female mosquitoes bite at night when most people are asleep. Malaria is not caused by heat, cold, working too hard, or eating certain fruits. It is only caused by bites from infected mosquitoes. Malaria is very dangerous for children and pregnant women. But we can all get malaria, and we must try to protect ourselves from getting bitten. Malaria mosquitoes bite people at night, so if you can, stay inside during the night. If you must go out, wear long pants, socks, and long-sleeve shirts. Children under 5 are at high risk of getting malaria. They get the worst malaria that makes them sick very quickly. Many children die. Pregnant women also need to be very careful. If you live in an area at risk for malaria, you must know that mosquitoes live and breed in still water. Always sweep up and get rid of water that may be around your home. Remember, adults can also die from malaria. Young children can die from malaria in 2 or 3 days. Always take a child to a doctor or clinic as soon as they start feeling sick. The clinic may do tests to check if it is malaria. It is very important that you give the prescribed treatment to the child the way you have been told to. The prescribed treatment will be different for each person who is sick. If you vomit after taking the medicine, take it again. It is very important to finish all the medicine, even if you are feeling better. Herbs and traditional treatment do not work for malaria. Always go to a clinic. Malaria can be treated if it is diagnosed early. If you do not feel better after 2 or 3 days after getting treatment, go back to the clinic. You may need a stronger medicine or different treatment. Mothers, if your child has malaria, keep feeding and breastfeeding your sick child. Pregnant women need to take medicine from the clinic to make sure they do not get malaria while they are pregnant. Malaria makes a pregnant woman very sick and can hurt or kill her baby. The medicine will protect her and her baby and is safe. It is very important for a pregnant woman to always sleep under a treated mosquito net. Using an insecticide-treated net over your bed is the best way to stop you getting malaria. You must tuck the edges of the treated net under your mattress. A treated net has insecticide on it that chases away mosquitoes. It also kills other insects. Some families have insecticide-treated nets but use them only in the rainy season. Sleep under the treated net every night, all year. Even if you don't see mosquitoes, there are always a few around. Some people say that it costs too much to buy a treated net or screens. But it is much worse to get malaria and have to get medicine from the clinic. The government has malaria control teams to spray people's homes once a year with special insecticides to kill mosquitoes inside your house. This is free and will help to protect you and your family from malaria. I'm glad I've had this chance to talk to you. Avoid getting malaria by using treated nets every night or by having your house sprayed. Get the right treatment immediately when signs or symptoms of malaria appear. Everybody, stay safe, protect yourself, and sleep under a treated mosquito net every night.